So welcome to the maintrac VideoCast. My guest today is Professor Katharina Pachmann. Professor Pachmann is the founder of the maintrac method and with research and publications spanning more than 20 years. Professor Pachmann is the chief scientist for the clinical use and the research of the maintrac method. Thank you for joining us.
Thank you for having me.
It is acknowledged that the maintrac method is the most sensitive method to identify circulating tumor cells out of blood samples. In your research and in your publications, Professor Pachmann, you differentiate between CTCs and CETCs. And there is a difference of that letter E in the CTCs. Could you explain what is the rationale for that? What is the reason? How does it differentiate to other methodologies that are being used to identify those cells?
Yeah, the term CTC refers to all circulating tumor cells, and there are also blood tumors like lymphoma, leukemias, and this would include all these cells in the blood. But what we do is we determine the number of cells from epithelial tumors in the blood. So we restrict it to epithelial tumors, and that's why we included the ECE, circulating epithelial tumor cells. And the way we do it is just relying on the special surface structures which are detected on epithelial cells. That's the epithelial antigen. And that's how we distinguish between the blood cells, the normal blood cells, and the epithelial tumor cells, because we think that there is neither size nor any other property that distinguishes the epithelial tumor cells from the blood cells.
It is most methods, and we can talk about some of the other methods in a minute, but most other methods use a system of removing the white blood cells first. And whereas in the maintrac method, the white blood cells are not being removed. So is it easier or harder to find these cells amongst the many white blood cells which are in the bloodstream?
That's exactly, if you try to remove the tumor cells from the white blood cells, you will enrich them, but you will at the same time lose also tumor cells. And that's why we decided not to do any enrichment step apart from the red blood cells, which we remove by lysis. And then we retain all the cells in the blood sample. But that's what we distinguishes us from others. We do not fix the cells immediately. We just leave them alive and wait for 24 hours to determine them.
Now, many other methods use the same surface marker, the EpCAM marker, to identify that. So it's using the same identifier. So the difference is that the maintrac method does not use any enrichment. Can you explain some of the other methodologies and maybe the reason why some of the other methodologies find less cells, certainly in the early cancer states? So could you explain that a bit better?
Other methods which are performing enrichment methods, they fix also the cells immediately when they are withdrawn from blood. And this obviously destroys part or hides part of these epithelial structures on the cells. And that's what we avoid. So we keep the cells alive and do not perform any fixation or enrichment methods.
It has often been said it is the holy grail to identify live tumor cells and being able to test them, in particular against effectiveness of medicines. and it's often termed as chemosensitivity. Now, what the maintrac method has got live cells, so not fixed cells, and can be tested against various cytotoxic agents.
Yes, that's what we can do with these live cells. So we expose them for different times to different medications, those which are requested by the doctors. And then we can see over time how the cells die during exposure to these medications. And this we can quantify and report to the requesting doctors.
I'm aware that there is a video available to actually observe these cells during this process, during the testing process, and it will be interesting to also see that or make that visible to our viewers. Thank you very much, Professor Bachmann.